Is it starting? Okay, starting. Hi, good evening. Today we are going to do a peripheral vascular and lymphatic system assessment. And first I will do a room scan. Okay. Okay, going back. So my patient here is Mr. Montagna, and I will have to ask him a few questions about his health history. Good evening, Mr. Montagna. Did you experience any leg pain, any leg pain or cramps lately?
No.
No. How about swelling?
No.
Okay. And you're still a smoker, right? It's been 10 years. And how many packs per day?
Less than one.
Less than one. Okay, thank you. And I will have to ask you to take out your clothes, just the shirt, so I can assess your peripheral vascular and lymphatic system. Thank you. And so I will do an inspection for this skin color and nail. Can you look at the skin color, nail beds, and any lesions and edema, no lymphadenopathy. I can just see some moles, and checking for presence of clubbing by checking the profile sign. Also on the other side. Okay, so less than 160 degrees. Now I will do palpation of your upper extremities using the palm of my hands. Just relax, Mr. Montagna. Just put your hands there, and I will palpate it here from upper torso down to the arms, and it's nice and warm. And after that, I will check for the capillary refill. Checking for your capillary, I will check your fingers. Okay. Turn whitish and then pinkish, about 2 seconds. Thank you. And so I will locate your brachial. No, first I'll start with the radial pulses. Okay, and the other arm. I will have to do this all at the same time. So to check if it's equal bilaterally, and checking now for the rate, rhythm, and the force. Okay, with the normal limits, and it's regular, and the force is 2 plus. Now I will go to check his brachial pulses and the other arm, and doing this again bilaterally. It's symmetrical, and checking for the rate, rhythm, and force. Okay, thank you. So now I will check, we'll proceed with the lower extremities, and I will have to move my camera a little bit so I can show his lower extremities. Taking out his socks and put your feet here. Okay, thank you. So first I will do inspection. Inspecting for the skin color, and then the nail beds, and then checking for the hair distribution. And the hair distribution is a little bit more on the medial side of his legs, and it looks fair to me, appropriate for his ethnicity. And then checking for any ulcers and varicose patterns. I can see some varicose, no, not varicose, but some veins, but it's not dilated. But probably because his feet is so white, and his temperature on his feet is a little bit cold. Did you go out, Mr. Montagna? Did you just go out from the salon?
Yeah.
To the yeah, so that probably is. And now I will palpate, checking for the skin temperature on his lower extremities. There. And checking now his capillary refill. Okay. And now I will check for the dorsalis pedis. It's lateral and parallel to the extensor tendon of his big toe. Yeah, I was able to locate it, but it's not as strong as the upper extremities, but I was able to locate it. Okay, checking for the rate, rhythm, and the force. Now checking for the posterior tibial pulses. It's the groove in between the here. Yeah, I felt it here. It's in the groove in between the Achilles tendon and malleolus. Okay, okay, I can feel the rate and I can feel the force, and then checking out for the rate and rhythm. Okay, so now I will proceed with the pretibial edema. I will check his pretibial edema. So the pretibial edema, I will just put check if he has an indentation. So pressing my fingers on his lower extremities, and checking and recording and probably measuring if I have to, for how long will it take his skin to go back to to rebound to its original position. And looks like there's no indentation there. So thank you. That ends my peripheral vascular and lymphatic system assessment, and that's all. Thank you.